Have you ever wondered why I have a headache here versus back here? Well, first off, I want to tell you the most painful, severe type of headache is cluster headaches, followed by migraine headaches. There are multiple types of that. But today, let's talk about tension headaches. And before we get into that, I want to tell you one thing. If you ever say the words, "This is the worst headache I've ever had in my life," you need to go to the emergency room. Just keep that in mind. Outside of that, you get that pain in the temple area behind the eye. It feels like there's pressure there. That's a tension headache. Sometimes that's because there's tightness of the SCM muscle, sternocleidomastoid. When you get a trigger point there, it'll refer pain to the back of the eye. Sometimes it'll be in the front of the head, forehead. That's because these muscles, upper traps, they have tension and muscle knots in them. Massaging these can get rid of the headache in the front. Massaging this. Now, if you're massaging this and you feel a pulse under your hand, that means you're on the blood vessel there, which is your carotid artery. Don't massage that. Not safe, okay? But if you're on the muscle and you find a tender spot, just gently hold it. Apply light pressure till the tenderness goes away. You'll notice the pain behind the eye might get better. And obviously, massaging your shoulders, upper traps can get rid of the forehead headache. But then sometimes you get this one that's really severe, and it's the back of the head, base of the skull. Sometimes that'll wrap up to the top of the head. That one could be because there's a misalignment in the vertebra at the top of your spine, or muscle knots in the back of the neck at the very, very top base of the skull. If you apply gentle pressure in the back of the skull and hold that, especially if it's tender, just softly press and hold. That will reduce the tension back there, and it may get rid of the headache you're having back there. As always, chiropractic care is crucial, because if any of these muscles are tight and tender and causing problems for you, realigning the spine and taking pressure off the nerves makes those muscles relax, and the tension headache goes away. Always remember, tension around the neck can affect blood flow to the brain as well. Now, sometimes if your headache has a throbbing sensation, that could be a vascular headache, and we want to watch that as well. You should see your primary care doctor for that, just to evaluate it and find out if there isn't anything more serious. Throbbing, pulse-like headaches you don't want to mess with. Like I said before, the worst headache of your life, you go to the emergency room. What could be causing that are serious things like tumors and aneurysms and so on. So watch out for that. But these tension headaches, you can work on the muscles, and different areas of the head can get better. Acupuncture is also good for reducing tension headaches. I am not an acupuncturist, so I'll let you find information on that somewhere else. I hope this helps you. If it does, send it to someone who's having headaches, share it with them, subscribe, and definitely comment so we can be in contact. Take care.